In this video, we will discuss about Coomb's test. So, Coomb's test, it can be done by three different methods. One is the tube method, second we have the gel method, and by using flow cytometry. So, in this video, I will discuss how to do it with the tube method. So, in Coomb's test, the anti-Globaline test can be used to detect red cells that is sensitized with IgG allo antibodies, and then IgG in autoantibodies or complement components. So the principle of this Coomb's test is that the incomplete antibodies, that is the IgG antibodies, that is attached to the red cell membrane by the FAP portion of the immunoglobulin molecule IgG. So we have the FAP portion and the FC. So these incomplete antibodies are attached to the FAP portion. Now the IgG molecules attached to the red cells are enabled to bridge the gap that is sensitized by red cells, which are separated from each other by the negative charge on their surface, and the sensitized cells does not agglutinate because of the repulsion. So when AHG serum is added to the watch sensitized cells, the FAP portion of the AHG. So in this figure, this is the AHG molecule. So the FAP portion of the AHG molecule, that is ND-IgG, it reacts with the FC portion of two adjacent IgG molecules that is attached to the red cells, and thereby bridging the gap between the sensitized red cells, these are the red cells, and causes agglutination. So that is the whole principle of this test. Now going to the types of tests, we have two types. One is direct Coomb's test and indirect Coomb's test. Now for indirect Coomb's test, this test is performed to detect presence of Rh antibodies or other antibodies in patient serum in case of the following. First is to check whether an Rh negative woman has developed anti-Rh antibodies. Secondly, we do it in case of transfusion of Rh positive blood, pregnancy in infant if Rh is positive, and in abortion of Rh positive fetus. So NDD may be produced in the blood or any negative person by the exposure of ND antigen exposure to the antigen by these following activities. Now direct Coomb's test or direct anti-Globaline test, this test is performed to detect NDD antibody or other antibodies attached to the red cell surface within the bloodstream. So this occurs in the case, as we all know, called the hemolytic disease of the newborn. So when there is Rh positive baby in the womb of a sensitized Rh negative woman, the antibodies produced to the mother's serum, it crosses the placenta, and after entering the baby's bloodstream, these antibodies will attach to the baby's Rh positive red blood cells, and then these coated cells are clumped and removed from the circulation. That causes hemolysis or hemolytic anemia. So we call it as the hemolytic disease of the newborn, HDN. So when the baby is born, the baby's blood is collected and then tested by the anti-Globaline Coomb's test, that is the direct test to detect NDD antibodies coated on the red blood cells. Now direct Coomb's test is also done for transfusion reactions and then drug-induced red cell sensitization and in cases of autoimmune hemolytic anemia. Now let's discuss about the anti-Globaline test. So the video part will be shown in the later part of this video. So coming to the explanation, first is the direct anti-Globaline test. So the direct anti-Globaline test detects sensitized red cells with IgG or complement components, that is C3p and then C3d in vivo. And then in vivo, coating of red cells with IgG or any complement may occur in any immune mechanism that is attacking the patient's own RBCs. So this mechanism could be autoimmunity, or it could be a drug-induced immune-mediated mechanism. So let's go into the procedure. So coming to the procedure, we have to first label the Coomb tubes. So as you can see, we have to label it properly in order not to mix up with other samples. So we use a red immediate samples. So we have to mix the sample properly by inversion. And then make red cell suspension. So for that we have to add normal saline to the red cells, and then we make red cell suspension. So how are we going to do to make this red cell suspension? First we will take few drops of we have to balance 2 tubes, and then we will centrifuge it in the centrifuge. So make sure that you balance the tubes by adding saline till the rim of the tube, and then centrifuge. Centrifuge at 3200 rpm for 2 minutes, and as you can see, you have to decant the supernatant, and you have to repeat this procedure for 3 times, as we've seen in the procedure for preparing red cell saline suspension. So we have to make 5% red cell suspension. So for that, you take the red cells and then add 19 drops of normal saline. And keep this in mind that the red cell should be red tomato color. So you mix properly, and then mix it by using a pasture pipette. Now we will use the Coomb's reagent. So to the tubes that you have already labeled, we will put 2 drops of Coomb's reagent. After that, you will put 1 drop of the red cell suspension that you have made. Mix it properly before adding the blood sample. Add it carefully. And then, as you can see the slide, it is liquid. So you have to centrifuge it again at 1000 rpm for 25 seconds to see for the agglutination. So after centrifugating, you have to observe it under a proper lighting. So if the test is negative, then there won't be any agglutination, and if the test is negative, then no agglutination, and if the test is positive, then there will be agglutination. So you have to observe this under good lighting. So as you can see in this tube that it is agglutinating, so it is positive test. Positive. So I hope you have understood with the video. We do the indirect Coomb's test now. So take 4 tubes, label them as T for test, and then auto control, positive control and negative control, and then take 2 drops of patient's serum into the test T labeled as T, and then to the auto control, and then add O cells, that is 5%, that is pulled O cells into the test. Take the auto cells to auto control. These are all pooled cells, and then normal saline to the negative control, and then NDD reagent to the positive control. And then add O cells to positive control and negative control, and incubate it at 37 degrees Celsius for 30 minutes, and then look for agglutination. In positive control you can see the agglutination and no agglutination on the other tubes. So add few saline to the test and all the tubes, and then add DD reagent, Coombs reagent to the test, auto control, positive control and the negative control, and then you have to centrifuge it. Centrifuge at 1000 rpm for 1 minute, and then you have to observe for the agglutination. So in this test, the test is negative. There's no agglutination, so it shows that no autoantibodies are seen. So I hope you have understood. Thank you.